what you can do then to assist that and to mitigate the symptoms is decompress that area. So you go to jiu-jitsu class, hop on a traction device, decompress the neck, give that disc some space to kind of reduce a little bit. Little known fact, discs can reduce themselves back into place, quote unquote. They won't go back full. They won't be 100% because once that vacuum seal is kind of broken, that's it, you're done.
Broken, right.
But you can have a major herniation sticking 50% of the way outside of the vertebrae from where it is, and you can reduce it to 10%.
Hello, friends. Thank you for tuning into this week's episode of the Mayn Idea Podcast, where today I have the pleasure of sitting down with Dr. Jonathan Amato. A quick reminder for those of you that love this podcast, please take 30 seconds and leave a 5-star review on Apple or Spotify and subscribe to the YouTube channel. This helps the show get discovered organically and helps me continue to bring on amazing guests. The other way that you can support the show is by sending an episode to someone who loves jiu-jitsu. Pick your favorite episode, send it over to them, and let them become part of the community and learn from some of the greatest minds in the sport of jiu-jitsu, as well as surrounding practitioners that keep athletes healthy. Dr. Amato is a physical therapist and certified strength and conditioning specialist who earned his doctorate from Mercy College after retiring from playing rugby. Dr. Amato holds a purple belt in Brazilian Jiu Jitsu and is a board-certified orthopedic clinical specialist. He has helped some of mixed martial artists' biggest names, such as Chris Weidman and current PFL contender Chris Wade, as they navigate injury while pursuing greatness in the world's most ruthless gauntlet. As someone who's suffered quite a few injuries myself over the life of my career as an athlete and issues that I continue to have from training jiu-jitsu frequently, I really found this conversation to be one of the most pivotal that I've had. There's some moments towards the end where we really hone in on things that us jiu-jitsu practitioners, should be doing to keep our bodies healthy so that we can have more days on the mats and less days laid up outside of the academy. I hope that you enjoy this episode as much as I did. Without further ado, Dr. Jonathan Amato. I have been looking forward to this one for a while. Thank you so much for taking the time to be on here. It's rare form to get professionals in your field that actually have an understanding of grappling sports, have worked with high-level athletes, and actually have an athletic history themselves. So I'm really grateful that you took the time out of your schedule to be here.
Sure, my pleasure, man. Happy to.
So I guess on the front end of this, because I have a feeling we'll probably get in the weeds at some point with all the different injuries that you can sustain as someone who practices grappling or is involved in mixed martial arts. But if we can rewind the clock a little bit back to your time as a professional rugby player, what was your mindset with regards to injury when you were an athlete? How do you get injured and keep going? What do you look for in terms of your mental health, return to sport? Like, what's that whole process for you like?
So my mom always said, if you're going to be dumb, you better be tough. Right. So growing up my whole life, all the sports I chose were on the violent or the physical side. So I've been wrestling since I was in 5th grade, all the way up and through college. I did my first year at college, I tried the club wrestling team at SUNY Cortland up here in New York. And I'd had enough of cutting weight by that point. And so then I found rugby when I was up there at college. But I played football, all my sports with my neighbors and kids and brothers and sisters growing up were always kill the carrier and always just wrestling and fighting. And so when I was younger, probably to my own detriment, I would just kind of put my head down and keep plugging along. Unless I was forcefully put out by the coaching staff or the medical staff for the respective team I was playing for at the time. I would try to hide injuries consistently, play through them. And if I had to do any kind of rehab or any sort of, care for the injury, it would be the minimal. I would rush things to get back on the field as fast as possible. All that being said, however, except for when I tore my ACL in college, I did take a full year to rehab properly and make sure I came back. But I didn't rush that one. But every concussion I had, I came back way too early. Every sprained ankle, every dislocated finger or whatever it was, I would always push the envelope and go a little too quick probably. now at 42 and with all the aches and pains I have from all of that, I wish I would have taken it a little bit more seriously.
Well,
But
that was, I can think back even to, playing like Pop Warner football when I was younger. I was a skier competitively for 12 years, but everything else I did
nice.
around that was like just to help me cross train, right? So skiing was number one. That was the focus. That's all I cared about. But everything else was to keep me in shape and get ready for that. And I remember just the mentality was, I don't want to say that it was like tougher and tougher is better, but
Yeah.
from the coaching level, like you just think about the educational level of your given coach, someone who's coaching kids after school for football, or they're doing like the regional whatever for soccer or something like that. They're probably someone who used to play and they loved it. They kind of get it, and they're looking for something to do, so they coach kids. But their knowledge of injury, return to sport, the process that, unless they've sustained some heinous injury like ACL, where they actually took all the time, the idea was get back out there. Come on, you're being a wuss. Get back out there, tough it up, put your helmet back on, and that there's pros and cons to that. On one side of it, you build that mentality that allows you to become a rugby player. Could you ever be a rugby player if you were just a sissy about every injury you ever had?
Absolutely not. Absolutely
Would
not.
never work that way. But what do you think is being on the clinical side of this, right? And the introduction will do service to how well educated you are in all these different fields, from strength and conditioning to orthopedics to the physical therapy field. What do you think the balance is there in any sport, not just grappling, but what should the focus be for any kind of coach dealing with an athlete who's suffering some sort of injury?
Well, yeah, that's actually a pretty loaded question, believe it or not. I think it depends on the level of the sport, right? So is the championship for the NFL on the line? That's a different story than the kid playing a Pop Warner game on a Sunday. Yeah, you know what I mean? Is it, is it the title fight that you've been fighting for your entire life versus a backyard brawl with around some cars with some lights on it, and you're getting paid $100 if you're lucky? Like, I think it's context dependent. However, now knowing what I know now, I think they should be taken a little more seriously than I think we used to. I mean, even so far as the concussion protocols we have now. We're a lot more cautious about returning to sport too quickly. Whereas, when I played, it was like, can you say your name? Well, you're good to go. Keep going. Like, I have multiple games. I remember, like, rugby games that I don't remember the entire second half of the game. I had a concussion, and I apparently played the whole game and did well or scored, but I'm on the bus all of a sudden now, and I'm like, when did we get here? Like, so knowing full well that my coaches did not know what to look for. They didn't know the proper scan. Even the medical staff that was there wasn't doing the right things to keep me off the field if I didn't need to be. So I just think that we've come a long way, even just for the average layperson coaching Pop Warner football, as to know what to look out for the detriment of the athlete or the health of the athlete, whereas 20, 30 years ago, we didn't, on all levels, professional all the way down to peewee. So again, it's context dependent. It's how important is the game, what level of which you're playing. And I think, people now are a bit more educated as far as the cost of injuries and pushing through them, and what type of injury it is.
If we take that and we kind of zone in a little bit, maybe more on combat sports, on grappling, you bring up something really interesting, which is the scale of the decision you're making, right? If you're in Cage Warriors and it's your very first fight and you're looking at hopefully like a 10 to 15 year career and ascending up into the UFC or the PFL or Bellator or something like that, and you sustain some crazy injury and you still have a full-time job, that's going to be a much different decision than you just advance all the way into the finals and the $1 million PFL contracts on the line.
Yeah.
But how have you walked through that decision with athletes? Because this is something I feel like the UFC does a very good job of letting you think that everyone's healthy up until the day that they fight, right? You're just like, oh, they're fine. Everyone's just healthy. Go train jiu-jitsu for a hot 7 days in a row, and you'll very quickly realize that no matter what, right, there is just a baseline level of injury that you're constantly operating at on the hobbyist level, not even on the professional level. Then you get to these guys, and what it really comes down to is some of them just bite their tongue and don't say anything, and some of them say stuff. So when you're dealing with a professional fighter like Chris Wade, what's kind of your like, okay, if it's this, we're going to keep fighting. If it's this, we really got to shut it down because now we're talking about the longevity of your career here.
Yeah, yeah. And again, it's even kind of an unfair question because he's already at the Mecca, right? He's already at
Right.
that level. He's already fighting for $1 million contract. So it's for him something like it's like, hey, can you do these handful of movements without pain? Okay, well then we can train XYZ this week.
Right.
So let's back off. Let's say it's a knee injury. Let's back off of X guard. Let's back off of butterfly guard. Let's back off of these, but you can still work on your side control. You can still work
Yeah.
on your mount. You can still let's work around the injury. Don't shut it down completely, but let's what can we still do to continue that training momentum without risking increasing the injury or making it any kind of worse than where we're at now. And then again, that's context dependent on the severity of the injury. Is it like a little, did you roll your ankle a bit? Well, yeah, we're going to work around that because
Right.
that'll kind of heal on its own if we can kind of leave it be. But, did you bruise a rib? Well, that's a different story. Did
Yeah.
stress fracture a rib? Was a concussion? Or do you have a stress fracture to your knuckle? So that's going to be a detriment. We can't really strike for a while now. That's going to throw some things off.
Yeah.
And if that's already kind of compromised before, 6 weeks out from a fight, like there's a good chance you're breaking that in the fight.
Yeah.
And how much of that is worth pushing through. And that's the conversation I have with all of them. And I have it, and I treat the guys I work with that are pro the same as I treat the 15-year-old soccer player.
Right.
How important is this? What would happen to you if you didn't compete in this? Is it game changing? Is it life changing or life ending? And can we work around it? And those are kind of questions I have with everybody, no matter what we're doing. It's like, or can we do things in place to kind of keep momentum going without stressing that particular injury? I pride myself on very rarely actually shutting it down completely. I try to
Yeah.
find a way to work around whatever the injury is for all of my patients and my athletes. And I know it sounds kind of like a crappy answer. I keep saying it's case dependent, but it really is. But to your point with Chris Wade, he's the kind of guy that knows his body so well that
Hmm.
he will shut it down before I even have the conversation with him. He's like, "Hey doc, I got to come see you on Wednesday." All right, cool. And then he'll say, "Hey, last Thursday I did this, so I haven't done anything since. Something really fell off to me. I just want you to check it out and let me know. Like, is this really bad or is this something I can kind of work around?" So when you get to the level of someone like Chris Wade, who they just know their body so well, it does make it a little bit easier for you as
Yeah.
the therapist. But it's just
That's
that conversation, an open conversation.
that part of the word I think is many people think of personal trainers and physical therapists and they think of the physical and the personal and they really neglect the fact that it's therapy. Like there's so much of what you do that's walking them mentally through what this might look like for them. That's such a big sticking point for athletes is the thought that they
Mm-hmm.
can't, the thought that they won't be able to, that they'll have to skip this. Oh, if I'm not training, the guy next to me is going to be getting better. If I'm not doing live rolls and they are, then I'm a step
Mm-hmm.
behind. How do you train yourself for that? Like to have those kind of conversations with people and you are like such a linchpin in keeping that wheel on the car to where
Yeah.
they believe, they buy into what you're saying. Go, okay, I have no idea what's going on. I'm freaked out because this is my career, but I trust in John to guide me through this. Like, what's that trust building process like for you with them? And do you ever find yourself fighting the athletes on what that road looks like?
Yeah, sometimes. I mean, luckily for me, it's gotten to the point where a lot of the people I work with tend to really trust me with just about everything, which is
Mhm.
good. But it's a team approach. So I'm going to have a conversation with their coaches, their striking coach, their grappling
Yeah.
coach. If I'm not their strength and conditioning coach, their strength and conditioning coach, whoever they're working with, to find out what what is this guy's mental state like normally? How's he reacting in training right now? Does he seem a little off? Does he seem like he's unwilling to pull the trigger on certain things? Well, here's why. Let's look into what's going on with it. There's a reason why. Just to get into physical therapy school, there's a certain level of psychology class you have to take because you have to
Mhm.
understand the human psyche and how that plays into the physical manifestation of injuries and or performance anxiety. Like you said, a lot of what we do as the physical therapist, a lot of it is just talking to the person,
Yeah.
finding out kind of what makes them tick, finding out what they're afraid of and why, and seeing if you can kind of ameliorate that by letting them know that like this is not a real thing to be worried about, and here's why. Or like you were right to feel this way, and we should probably back off of this and let's delve into that a bit more and find out how cost effective is it for us to push through it. But for me, it ends up and I wish I could tell you how I'm able to build up that trust with people. I just think it's my innate personality. I'm very blunt. I'm
Yeah.
very to the point. I don't sugarcoat many things, which makes me I'm not for everyone because they don't like being told they don't want to hear constantly, versus some people really appreciate that. They know that I'm not going to bullshit them and sugarcoat it and really blow smoke up their ass. I'm just going to tell them, here is this injury. Here is how your body has responded to other injuries in the past. The likelihood of this being a real problem for you is this. And how can we work around it?
How important or utilized, even if it's not something you utilize, but how important is data on an individual, like compiled data over the lifespan of someone that you're working with, to be able to reference back and say, hey, we've been here before. If we look at your program in this phase leading up to that fight, or this leading up to this, to help have that conversation. Is that something that you utilize?
Yes, definitely. And let's take someone like Chris Weidman, right? The guy is an amazing athlete. He's got the mental fortitude of a Navy SEAL. The guy will push through anything, but he's had 19 surgeries over the course of his career. So he's been injured a lot. Now the last one he's had over the last year and a half has been a very challenging one for him. He's coming back in August for the card up in Boston.
Yep.
He's only competed once in anything since he's had that leg injury. He was in Europe, in London, for that grappling tournament he did, the grappling fight. It's a lot of how much is this mental stuff going to play a role for him? And this is where we go back to the data. Hey, man, you've had this knee surgery and you came out of that no problem. You've had your neck vertebrae and your discs replaced. And you fought back from that. So what is the likelihood of this being as big of a problem for you? That sort of thing. You kind of have that conversation. You bring them back to, where were you 5 years ago? What was the injury you had? How'd you push through that? Well, you made it back from that, right? Well, is this that much different?
Right.
No, not so much. Sure, you're a little bit older and there's a couple of things that play into it, but you've been here before.
If you look at someone like Chris Weidman, he's a great example because you just listed the frequency and how many times he's really suffered an injury in his career that was an important one, right? Not just the stingers and things that you're going to eat as someone who does this kind of stuff. Knowing what you know about strength and conditioning, knowing what you know about on the clinical side, knowing what you know about physical therapy, available treatments, protocols, fight frequency, being a purple belt, actually experiencing jiu-jitsu. Why do you think it is that some guys sustain so many injuries in a career? And not that they're not any scrub. This is Chris Weidman, right?
Mm-hmm.
Took out Anderson Silva. This guy's not a scrub.
Right.
How does someone like him sustain so many injuries in their career, and somebody else can have an equally long, durable career and they don't? What do you think the factors are that lead into that?
I think it's largely genetic, and to what degree I don't know. Because if you place him side by side with Uriah Hall or someone else that it's his caliber, his weight class, his pedigree leading up to it, why is it that Chris gets hurt more than him? When Chris takes his recovery and his rehab and his in between session stuff more drastically, and he takes it more emphatically than his actual training sessions. Like, the guy is all about the next possible recovery thing. What can he eat? What can he take? How can he get a hyperbaric chamber to sleep in just to increase his blood flow? Like, he will do anything and everything to recover properly. That's what he's doing now. The guy's all over everything. He's doing everything under the sun he can to make himself recover better. But why is he getting injured? The only factor to me that makes sense is there's some sort of genetic component to it, whether it's the collagen fibers in his tendons aren't as strong as Uriah Hall's. His bones are slightly more brittle than somebody else's. Because it's not like he's not recovering properly. It's not like he's training 3 times a day and going out and boozing all night and not sleeping. Like, he's doing all the right things for recovery. Yeah. But why is he injured so much? To me, the only common denominator then becomes it's a genetic component. Now, what that is, I have no idea exactly, but I'm sure it is something.
I think about this all the time. So, even in my own body, I'm much of Chris Weidman's camp. I'm in, sauna multiple times a week. I stretch every single night. I have like a mobility protocol within my strength and conditioning. I'm doing ice baths. It's like everything that I can do to recover properly and give me the best edge, just as a 34-year-old hobbyist who likes to do this stuff. I'm doing it because I love it. I absolutely love it. And it's important for my like mental well-being. But then there's just flare-ups. I get a slight herniation, a lifetime of impact sports, creative protrusion, and my L5 vertebrae. And there's just things that like add up. And I was just thinking about that the other day going, like, what gives? Shy of doing performance-enhancing drugs that aid in recovery, why is it that some guys can go in there, on 4 hours of sleep, hungover, train like an animal, and repeat this cycle over and over and over and over? It which seems really interesting to me, especially with the popularity, I think, as of recent years, and how popular recovery modalities have become.
Mm-hmm.
And
Yeah.
with social media, I mean, you can't scroll in any direction and not be hit with like the next best way to
Yeah.
one up
Yeah.
your game.
Bulletproof your shoulders, or buy this new boots, or increase blood flow, or
Yeah,
mimic high altitude training with this
yeah.
mask. And I mean, yeah, you're right. There's a gazillion things out there. And I honestly, back to what I was saying, I really think there's some sort of genetic component to it. Because like you can take two people that do all the same exact things, and that one guy's hurt every other week, and the other guy just seems like he's like Superman. He just never gets hurt.
Yeah.
Their diets could be the same, their sleep patterns, everything is the same, but one guy gets hurt more than the other. Like the only thing left there, then, to me, is something in the genetics,
So
whether it's a long line of.
if we were to accept genetics as the X factor and then look beyond that, what would you say is kind of the hierarchy of things that you should be pursuing to give yourself the best opportunity to keep more days on the mats, more days striking, more days training, even if there is some sort of genetic predisposition? Like, is your cold exposure and heat exposure more important than, and I have a feeling it'll be a case by case basis here, but if you had to kind of assess those from a bird's eye view, like what are the things that the hobbyist, the guy got a 9 to 5 job, they're getting into play
Yeah.
jiu-jitsu 3 days a week, they love it, but they're banged up and they're looking to improve that?
Yeah. Okay. So I think that's a pretty fair question. And you can boil that one down to some basic stuff. So like, to me, then again, it's like age dependent, right? When you're 22, you can get away with about anything. You're 30,
Literally.
you're 35, you're 40. Well, now there's certain things that have become more important. And I'll just give you, like myself, I would sacrifice sleep in my 20s. I get 4 hours a night. I would weight train in the morning. I would do some cardio in the afternoon. I'd have rugby practice at night. I'd work as a trainer or strength coach for a while. And again, 4 hours of sleep and night after night. And I just seemed to like never really get hurt by it. Now you hit 30, and now I'm trying that same thing, and now it's little niggling injuries here. My toes this, my knees that, my neck's a little more jacked up, my back's a little more painful. Age does play a role there because you start to lose your type 2 muscle fibers.
Yep.
I think of like 2% compounded every year from 30 on. So now you have a problem with your power output. But collagen fibers tend to break down a bit more. They're not recovering as quick as they used to. The bone density may be demineralizing as you're getting older too, for whatever reason. So what do? Then to me, it's sleep is probably number one important. And it's got to be good, deep, restful sleep. And a lot of us, myself included, struggle with attaining that. Um, it's got, 8 hours of good REM restful sleep. Most of us have a really hard time getting there, whether you have sleep apnea or you had
Children.
caffeine too late in the day, children, there's all these things that are a factor there. So the hierarchy for me then becomes sleep is paramount if you can get that. Next would be your nutrition. Are you getting the right amount of protein for your size and your body density to aid in muscle protein synthesis to recover properly? Are you getting enough calcium for your bones to regenerate bone demineralization? Is your carbohydrate load high enough to provide the glycogen you need for the energy for the day? Is your fat level intake high enough to aid in hormone production in your body for the rest of the day? So nutrition becomes kind of like a big number two. And that can look any number of ways depending on who you are and where you're from, that kind of thing. But is your nutrition on point for the most part? And then it becomes like your recovery modalities. Are you doing the stretching? Are you doing the cold or the hot plunges? Are you doing, light, like steady state cardio stuff to kind of keep you moving, but nothing too taxing on the central nervous system? Hydration is obviously that thing. I kind of put hydration in there with nutrition. Like hydration is super key. Your body is like 80-something% water. So if you're dehydrated, well, yeah, sure, everything will start breaking down. You're going to have tighter bones, tighter muscles. Things will be more brittle, more likely to be injured. And then it becomes your supplemental training styles. So if you're a jiu-jitsu player who does jits, 2, 3, 4 times a week, are you able to get in 1 or 2 total body strength sessions a week to maintain your overall strength and stability of the muscles? At that point, if you're the hobbyist, the cardio is not as important because you're getting that cardio in your rolls 3, 4 times a week anyway. So you're getting more than enough cardio in that. So then it becomes like the strength training would be like number 4. Are you getting enough total body kind of strength work to, keep you up to par as far as strength's concerned and your pliability and mobility? People they misconstrue strength training as seeing it makes you tighter. But if done properly through full ranges, you actually get more mobility in the rest of your life if you do strength training the right way. So that becomes kind of like number 4 for me. And then everything else, good luck.
Yeah,
But it would
it's
go sleep, nutrition, supplemental stuff, and then your strength training.
it's interesting when you just kind of being in the academy. And so I've, for the better part of 10 years, been a personal trainer myself and took my like athletic career background and then did general population stuff like that. And just being on the mats and listening to the general kind of the overall aches and pains, not literally, but that people find in their life, they tend to overlook sleep, overlook
Hmm.
nutrition, and reach for strength training and go,
Yeah.
I'm getting banged up on the mats because I'm weak. And I'm getting banged up at the mats because I'm not running enough. But they're sleeping 5 broken hours a night. Their
Hmm.
nutrition is inconsistent, trashy, and then blown out on the weekends, which is 3 months out
Hmm.
of the year if you stack them up.
Yeah.
And
Yeah.
they don't focus on their flexibility and mobility because it's a task, right? Even though it's 10, 15 minutes a night. I mean, it's nothing. And they just try to stack dysfunction and strength. And when they're doing the strength workouts, they're not getting in with a professional who deals with athletes, right? They're Googling
Right.
something, they're finding a bodybuilding.com mega set for some dude who's
Yeah.
just trying to get jacked for summer. And they're doing that, and it's by no fault of their own. Like, hats off to them for trying to do the right thing in the first place and like level
Mhm.
up their fitness. But that, I think that these conversations are so crucial because most people don't have access to a Dr. Amato. They don't have access to a UPI. They don't have access to a personal trainer, either from a financial standpoint or even access to one that's knowledgeable. And
Right.
so they're stuck in this spot where even with their best efforts in the right place, the outcome's just subpar because they don't have the right information. And it's so
Yeah.
hard. I'll give you an example. Like, even I went to my healthcare provider the other day because I think I like tore my meniscus bad in this jiu-jitsu tournament. And I have a video of it. My knee's 90 degrees to one side. I heard a pop, the whole thing. I went to
Yikes.
like a general practitioner, and he goes, I want an MRI. I want to know. And then I want to make the
Hmm.
steps necessary to move forward, to find someone like yourself or get out there and like start the program to get back to sport. And I go in there and he goes, just lay down on your back for me. And he does a reaction test, where they hit
Like a
your
reflex
kneecap.
test.
And then
Okay.
he holds my heel, does this with my leg, and then he goes, I'm gonna pull your leg a little bit, all right? He pulls my left leg, pulls my right leg, and he goes, I think you're fine.
Oh,
And
Jesus.
I'm
Yeah.
like,
Yeah.
dude, you think I'm fine? Why? Because like anything that you do to my body is not going to be responsive because I strength train all the time. Like, you can pull and
Right.
push and prod, you're not going to get a response. This is an internal problem. And just the fact that they don't want to give you what you need, or worse, they don't know how to give you what you need.
Yeah. Now, when you say general practice, you mean just like a GP, like your doctor you go to if you had a cold type of thing,
Yeah,
or was it an
like, hey,
orthopedic?
exactly. Like, I'm here for my, basically, I had to, with, and this is a whole nother can of worms. With my healthcare, I had to go to the doctor, have them prescribe the MRI, then have the insurance accept the MRI and go to the facility if I didn't want to pay
Yeah.
out of pocket, which is what I ended up
Right.
doing anyway. Um, but yeah, this would be a regular doctor. You go in, you get your annual checkup or your blood pressure
Yeah.
checked or something
And
like
see,
that.
that's part of the problem is that they are kind of the first line that insurance uses to okay the next step in the process.
Right.
However, they're good for keeping you from dying, and that's kind of it. Yeah, honestly, it really is, and
Straight
and
up.
and it's not meant to be a knock on them. It's just that's what their job is to. What's this illness you have? Can we treat it with medication,
Right.
or they're more of like an internist. They if you're sick, take this. Your blood pressure is this. Try this. That's what they're there for. And you have some that are, hey man, this is out of my wheelhouse. You got to go see an orthopedist or a specialist. Those are the ones that I'm like, awesome man, good job. That's what you should be
Right.
doing. But the ones who think just because they have MD after their name, they all of a sudden suddenly know everything in the human body. To me, it's just ridiculous because you don't.
Yep.
You're overworked, you're underpaid, you're seeing 45 patients in a day, half of which don't even want to be there or don't like you. You don't want to be there either. You're severely overweight and unfit, and you're telling somebody else to go exercise more, and they don't want to believe you anyway. So it's this whole big process that's just, it doesn't work out in their favor. And that's the stuff that really irritates me is that, listen, if it's not in your wheelhouse, refer them out to somebody else.
Right.
Send them to somebody that's going to actually do the proper testing to them. Send them to an orthopedist or to physical therapy, a good physical therapist who will do the right clinical testing to ascertain whether or not there's warrants an MRI, or it can,
Right.
hey, yeah, you just tick 5 of the 6 boxes that says you have this, like it's likely you have this tear.
Right.
what are we going to do about it? Instead of just a couple arbitrary pulls and pushes. I mean, the reflex hammer, what is that even doing? I don't understand the point of that. But,
Amongst
that's,
other things.
yeah, yeah.
What
So,
when
I mean,
in your view, having a lifetime in this career, what are your thoughts on like how the medical system is? It's especially pronounced in the combat sports arena because the demands are just so misunderstood by the average person, or their perceptions of what the athletes are doing don't make sense. How do we
mhm,
actually get to a place where the sport's going to keep growing, right? More and more people every single year are doing jiu-jitsu. More people are doing wrestling. They're getting involved in combat sports. The stars are getting bigger. The reach is getting further. I mean, even the fact that you have, and I hope this never happens, even the fact that you have Mark Zuckerberg and Elon Musk even talking about, let alone actually
yeah,
training mixed martial arts, it says a
yeah.
lot, right, about where this is headed. How do we get to a place where the medical system in place functions properly for people that are doing this after work all the way up to professional athletes? Because
Pros,
you're
yeah,
also unique, right? Even within your field, there's got to be
yes,
tons of just hacks that don't
yeah.
have any perception of what's going on.
Yeah, none. And I mean, that can be said for any field, right? You have some great teachers and you have the horrible ones that mail it in every day. You've got the great doctors and the horrible ones that mail it in every day. You got, I mean, in every field, there's the hacks and there's the ones who kind of excel or rise above the rest, right?
Right.
Um, I think, right, to answer your question right now, the system is so broken that it's not a one size fits all answer. The first thing is you got to be your own advocate. You have to demand things that you want because otherwise they're not going to give it to you.
Straight up.
And I mean, if you yell at them, they're not going to do anything either. So it's a way. It's almost like you have to like inception them that they thought the idea of the MRI was a good idea. Like but you
Right.
do it in a way that like it was their idea, not yours. But you have to really
Black
advocate for
magic.
yourself. Yeah,
Yeah.
no, you do because they are stuck in the system because they got to do what they got to do to get paid. And again, like I said, overworked, all this sort of stuff. So like there are things that they miss, and I deal with this. I mean, constantly where I get people that come in who are severely misdiagnosed by the person because they spent 30 seconds with them. Like how many times, and anybody listening to this or watching this can attest that you go to let's say an orthopedics appointment and you waited for 2.5 hours and you spent probably a grand total of 45 seconds with the orthopedist,
Yeah.
maybe 5 minutes with his PA, and then that was it. Like, what are you possibly going to figure out about that person in that 5 minutes and 45 seconds? Nothing. You're not
Yeah.
going to figure anything out. And that's why, the physical therapy evaluation can be anywhere from 45 minutes to an hour because you're testing everything. You're ruling in, ruling out as much as humanly possible. That's not very cost effective.
Right.
As far as the money making model is concerned, but that's better care for the individual, for the patient. It's a matter of they need to spend the time with you. But if you can't get somebody to do that, then you have to advocate for yourself. You have to say, hey, I know my body. I know there's something wrong. I would really like it if you refer me to this over here. Do you think I should see this sort of person? Is it a good idea maybe just to be sure to get an MRI? Like, how do I start that process? Like, and just kind of like really as nice a way as possible you can, because then the other thing that happens is egos get in the way with some of these guys. Is like if you even remotely tell them
So
they're doing
weird.
something wrong, or they get the notion, they don't want to help you at all anymore. Like, oh, you know more than me. Your Google search was better than my 10-year doctorate. Okay, well then you must know everything. So we have to get out of my office. So you have to
Yeah.
learn to talk to these people with kind of kid gloves because your future is kind of in their hands. If you piss them off, they're gonna nip everything in the bud for you. So now you're screwed. Um,
When you're treating do we step out of the pro and into just kind of like the general population? Someone's coming in because either they were A, referred, or B, they're taking this into their own hands.
mhm.
When you're working with an individual, is it end up, maybe you're not a good example actually because you're so knowledgeable of strength and conditioning, but in a given program, are you kind of blending physical therapy into like prehab rehab into an actual strength program for someone,
Mhm.
and
Yeah.
that's a good way to get them in the door? Or are you also doing isolated strict, like they just got out of surgery PT and they're not quite to the stage yet where they're getting into a program?
Both. I mean, I have all those. I get the person that walks in who's just, they tweaked their shoulder the other day and they don't know why. Or I get the guy who's here, 2 days after ACL reconstruction. So I do both versions of that. It's bare bones from that. Ideally, if you get the person who, they tweaked their shoulder yesterday, the evaluation goes something like, I spend a good 15, 20 minutes on the subjective. I let them just talk.
Yeah.
What happened and why, any injuries in the past, and then just yap away about anything and everything. I try to get as much information out as I can, because if you give the person enough time and you ask the right questions, you're going to get 75% of your answer just from that 15 minutes, that subjective portion of just listening to them talk. Then from there, now you've kind of formulated a general hypothesis in your head about where this could possibly be going, and you narrow down. Instead of testing everything under the sun, which could take you 4 hours for each person, you bring it down to a couple clinical tests that are super important that you've had the experience with over time, that is fairly reliable. That's going to get kind of an answer closer to what you want to do. And then when you're building there, after you figure out what it is, you build a program. Yes, a lot of them look prehab. What are we going to do for mobility, warm up stuff to get everything going? My general philosophy is facilitate that which is inhibited, inhibit that which is over facilitated, and reinforce with corrective exercise. So what that could look like is a million different things, but generally it's mobility kind of stuff, prehab, rehab, core strength training, and then like your finishing type stuff. Yep. So most people, unless they are there for a very specific reason, like you said, they're day 2 after ACL repair, they're all getting sort of that prehab, rehab, core strength training stuff, if I can, And like you said, the way the medical model works, it's I'm only given a certain amount of time. They're going to get 12 visits. How much can I really get done in 12 visits? That kind of thing. And that's where having a hybrid practice like I have is better, because then I have the cash-based side too, where, all right, you want a standard PT visit where you're going to spend about 15 minutes with me and then do some of your exercises and get your modalities. That costs you X. You want me for an hour one-on-one, it costs you Y. Right. And you give them the option. Or you can come be your own PT stuff, and we'll do what we can. A lot of them at first, and again, this is dependent on where your facility is. If it's fairly affluent, people are willing to spend the money. They don't really care much. They could be a triathlete who's a bond trader who's got money coming out the wazoo, and they'll spend whatever it takes to make sure they can shave 10 seconds off their TT time. Cool. Awesome. Those are the people you like working with, because they really want to get after it. Then you get the guy that, they're busting their butt 7 days a week at a job they hate to provide for their family, and they have insurance. It may be the crappiest one out there, but they want to use it because they're spending $2,000 a month on a family premium. And they've got a $75 copay for everything they do. And so they want to utilize what they're already paying for. Eventually, though, they tend to figure out that if you go that route and you go with what is easy and what is already paid for, you're not going to get the results you want.
It's such a bummer. I was a trainer at Equinox for 7 years in Santa Monica, and it ended up that the top thing that Equinox offers is a TRX coach. So you do everything that a normal trainer would do, but you also do active and resting metabolic assessment, you do a postural assessment, you use all this fancy equipment. And after years of doing that and running another business, I just can't stress enough to people how valuable it is to have the hybrid. And I think it's a huge flaw in the longevity of the business model. I totally get why upfront it's you take the ACE weekend certification or the NASM certification and you just pump them in there. You get them to charge $135 an hour. You take 80 of it and they're just cash cows, right? And the clients don't know the other because they're just having fun trying to lose weight. To get in with a facility that understands physical therapy, corrective exercise, and strength, and I really mean and later strength, because most of these people, and I say this with regret, most of these people don't have any business training at the level that they're training at. And I don't mean that as a knock on them, but from a safety, a longevity standpoint, and what are your life demands? Are your life demands carrying groceries, picking your children up, and occasionally playing pickup hockey? Okay, you don't need to be deadlifting 2 times your body weight, or even working towards 2 times your body weight. And that's where injury happens. And then on top of injury is frustration. And then you have an underskilled person who doesn't really understand the body fully because they got their certification out of a textbook, with someone who's dealing with a real life injury that's going to potentially impact how they play with their children down the line. And now they're forced to be in a situation where they have to use their healthcare to fix it. And it's such a bummer, whereas you could build out more, and I wish there were more of them. It sounds like what your practice is, where you're really taking the full spectrum of intake to go, well, actually, where are you at today? And what's the literal best way to handle you going forward so that you're happy and healthy?
Yes.
And it's, again, where, people don't get access to that because it's not common.
It is not. It is not common. And, unfortunately, in the physical therapy realm, most clinics are set up to generate a lot of revenue, but their outcomes are crap, right? And here's the thing, you can be a very mediocre or even a very crappy physical therapist, but if you have a good personality, people become loyal to you because you're a good guy.
Straight up.
but you may not really know what you're doing,
Yeah.
and they don't want to say anything. They want to speak up because you're a good guy and they want to hurt your feelings, or they, but what it boils down to is this is your body. This is your health. This is like things that you want to do for yourself. If you're not getting the results you want, like, why are you not moving on? Like, if you went to a steakhouse and you ordered a medium rare steak and it came out well done, and you're like, all right, maybe this was a fluke. Okay. And you went there again, it happened again. Like, would you keep going back? Like, no, you wouldn't. So it's
Yeah.
like, I try to stress that it's the same thing with this. If within 3-4 weeks, if you're not noticing some sort of change in the direction that you want to go, like, why have you not spoken up to at least say something to the person that you're working with? Or why have you not changed? And again, sometimes it boils down to affluence. Do they have the money to pursue something different? Unfortunately, they don't know anything. They don't know any better. Maybe they weren't an athlete in high school or college, and they didn't have access to like what looks like good training. Even I say that with kind of a cheeky grin, because I get some guys that come to me from high end, Big Ten schools or West Point, and like the stuff that they're getting done to them or for them via their medical staff or their training staff is just mind blowing at how bad it is.
Yeah.
And you think at a level like that, they would have like the best of the best, but they really don't. Some schools might, but not all of them. So maybe these people that are now getting this physical therapy have never had access to or never experienced a at least mediocre level of treatment. So this is all they know. They just know that, the 5 sets of 10 with cuff weights in the back doing this, slap a hot pack on and some stim. That's physical therapy, and that's about all it's going to get. When in the reality is, it's not all it is. And I'm sure you know that pretty well. It's, if tailored and set out properly, like it should be a custom to the individual, to their goals, to their strengths and their weaknesses. If I just hand you a pack and say, this is my knee protocol, like, well, I'm doing everybody a huge disservice.
Totally.
Like, that's just, that thing drives me nuts.
And on
this guy who's a jiu-jitsu player is sitting next to Grandma Gertrude, who had a knee replacement. We're doing the exact same exercises. Like, how is that even possible?
And the other flaw, I think, just in the way things are designed on the personal training side, is that personal training really lends itself to charisma. And you can look to any successful gym and you'll find this, that usually, and unfortunately, the top producing, and it's not to say that this is false sometimes. Sometimes you have a high producing, charismatic person who's also very good at what they do. But many times what you get is a very charismatic person who's really good at being there for you and looking you in the eyes and selling and building rapport. And they're not actually very qualified on the understanding.
You have great genetics and look like you know what they're doing.
Look great, talk great, not actually great. And the person doesn't know the other. And it's apparent everywhere, even more so in situations where, like you said, it's an affluence issue. Like, if you take the ability to pay for a session that's $160 out of the picture, now you're really falling off the cliff in quality, because you're down to a super low level, like zero barrier to entry, plus the gym's not really making that money. So what's their incentive to further the education of their employees and really get people on board with forward thinking modalities? And so the person's just SOL.
It's actually really funny you brought that up. So that was one of the decisions why I decided to go back to school to become a physical therapist, is that I was a strength coach. I got my CSDS back in like 2006. And I was doing some training on the side and this sort of stuff, amongst other things that I was doing. And I started to realize I was getting a little older. I'm like 25 now, I'm 26. I'm like, is this sustainable into my 50s? Yeah. Am I going to be able to compete with now vying for this person's money with the 22-year-old kid next to me with an 8-pack when I'm 44 years old and I got a little bit of a gut and maybe I don't look as fit as I used to? Unfortunately, no. People tend to judge everything, a book by its cover. So that if you sat me next to this ripped 22-year-old kid and I'm a little kind of chunkier 42-year-old guy, 9 times out of 10, they're going to pick the ripped abs guy. Even though he probably has never done anything right his entire life, but he's been blessed with great genetics. Like you said, he's very charismatic. So that was very frustrating to me. I was like, if I plan on having a family, like my livelihood can't rely on people thinking that I don't know what I'm doing and they hire the other guy instead. So then one of the reasons why I had gotten into physical therapy is like, people are always going to be hurt, right? So there's always going to be a need for a physical therapist. There's always something out there. So I'm now not competing for my looks. It becomes now based on your knowledge and everything else you have. It just so happens that, I maintain my strength and conditioning certification, and I still do a lot of that with some people on the side to kind of keep everything fresh. And it's something I really like doing.
Right.
But I got out of the straight personal training because I don't want to compete with the 23-year-old kid next to me because he looks like he's shredded. Like, it's just,
Right.
It's sad that that's what it comes down to, but people will look at two people and they'll judge it and say, well, that guy knows what he's doing, when he definitely doesn't.
I mean,
Um,
Kelly Starett, and I say this lightly because I would love to one day have him on the show too, but Kelly Starrett's a great example of this. He's not the most ground shattering person to look at, right?
right.
But the guy is an absolute phenom when it comes to understanding and pushing forward the ideas of like mobility, flexibility, stability, and how they all align. And he's done a
100%.
huge service to the world of actually, I don't even want to call it functional training. It's such like a hot word, but like training for sport, training like you actually want your training to do something for you, not just for the aesthetic, beyond the aesthetic, well beyond the aesthetic. And he's a prime example of that. The knowledge base is so evident, but it would be a bummer if someone made a choice solely. I mean, it's hard, right? Because then on one side, it's are you living the lifestyle that you're advising is usually the sticking point there. People say you should be advertising the lifestyle.
Right. You shouldn't be 400 pounds and try to be a personal trainer. Like that, to me, that's not going to happen. Like, you should look like you at least work out every now and then. But like you said, if you take Kelly Starett and you take his shirt off, and you put next to Terry Crews and you take his shirt off, and people don't know who they are, I guarantee you, if not 9 times out of 10, 10 times out of 10, they're picking Terry Crews over Kelly Starett every time. But they don't know that the knowledge base is there. And he looks like he works out to me. The guy does CrossFit. He works out. Like, he looks like he trains. He's not like the guy is not sloppy by any means. But when you compare him to, like, the shredded kid, like, you're going to lose out there.
Yeah. I mean, Phil Jackson's not doing a fadeaway jumper, over the next most contestant point guard. It's like there's a knowledge base that supersedes the aesthetic. And like when you're in sport, you find that out, that you don't care. All you care about is how knowledgeable this person is. What do they really know? And are they able to apply that to this athlete, that athlete successfully?
Unfortunately, I think that is very true. And that is something I hold near and dear, especially. But like, I think that only holds water once you get to the level of the professional athlete or your name is big enough. You hear Phil Jackson, I don't care who you are, he's a pretty big guy when it comes to basketball.
Oh, you're saying like in the competition up until that kind of
so it's like if you took everything out of the picture, Phil Jackson's accolades speak for itself. It doesn't matter if the guy's 72, 92, or if he could ever dribble basketball ever again. His knowledge base and experience are superior to anybody else.
Right.
But if he didn't have his name and the background behind it, people wouldn't know that he had that knowledge, is what I'm saying. So that's where the looks come into play a bit more. They come into play first all the time. And it shouldn't be that way, but that's the way it is.
Do you feel like that's true if we go outside of the commercial setting a little bit and to deal with like fighters, for example? Like if I'm really going to get care, I'll be honest, I kind of want to see like cauliflower in the person who's telling me about like, that's a perfect scenario for me. Honestly, if I found a medical professional who was like advising me on how to recover for jiu-jitsu or how to best hedge my bets, and their ears look like muffins, I'm stoked, because I'm like, that's only earned. Yeah, that is only earned, right, by years of either wrestling or doing jiu-jitsu. So is that true in the combat sports arena as well, or does that start to fall away?
It is, and which is why I tend to treat a lot of combat sports athletes, because I do train. I have my purple belt. I probably should be a brown belt by now with the amount of time that I've been involved. It's just the last couple of years I've had multiple surgeries, kids, starting a business, things that I train for 3 months. I don't train for 6 months. I train for half a year. I don't train for 6 weeks. There's been a lot of like ebbs and flows in my journey, but it still becomes a name thing. It's a word of mouth thing. So you want a guy who knows what he's doing, go see Amato because he trains and he's worked with ABC, these people here, versus like, go to that PT down the road who's never trained jiu-jitsu before, so it's like having some experience. And you don't have to be a black belt. You don't have to be you don't have to be like an all-star, but you have to at least experienced it so that you can relay that knowledge to the individual. You can sympathize with them about how much they want to train and what they can and can't do with it. And to me, it's knowing certain positions. So like, if you go to the average PT who's never done jiu-jitsu in their life, and you're like, listen, it really bothers me when I do butterfly guard. They're going to be like, they have no idea what that means.
Right.
So they have no idea why it would be affecting that part of your knee. They're just going to be like, well, I just, don't train for 2 weeks and see what happens. Instead, where, someone like myself or somebody who trains would be like, all right, well, let's stay out of butterfly guard for the next 2 weeks, or stay away from lasso guard or anything that would put stress on the outside of that knee. And like, let's keep training around that type of thing.
Yeah.
If you didn't train jiu-jitsu, you'd have no idea what that was. So you don't necessarily have to be a great practitioner, but at least be involved in it in some way, shape, or form.
How did you find jiu-jitsu?
Interesting
this
question.
forward is probably what everyone's really on board for, like the jiu-jitsu injury talk. So what was your first introduction to that?
So I retired from playing rugby, and I want to specify in the States, I was at the time that I played, it would be considered what the pro league is now. So now there actually is a pro league of rugby in the United States.
In New York.
The MLR. In New York,
Yeah.
but there's 8 pro teams in the country.
Gotcha.
So the level I played at, which was the Super League back then, would have been what you would consider pro. And now I didn't make any money off of it. We got our travel was paid for and that kind of stuff, but I didn't get paid to play. If it was, today, I probably would be on that pro team and I'd be getting paid to play, and that'd be great, but it wasn't really popular enough then. So I retired from playing rugby because I was just, playing since I was in college, and it was probably a good 15-year run, and the rig took some damage, but, yeah. So I went to, got back into PT school, finished my degree. So I got out and I moved back out to Long Island because I was living in the city for about 10 years. And a good friend of mine, my best friend since like second grade, has been for years training jiu-jitsu. He's like, dude, you got to try it. And we wrestled together from, 5th grade on. And we had his whole career together. And you got to try jiu-jitsu. You got to try. I'm like, I stopped wrestling because I was over it and I didn't really want to do it anymore. I'm good. But eventually the school that I now train at, they were looking for a trainer to do a boot camp class for the mommies and daddies while the kids were in kid class.
Nice.
And I was still finishing up PT school. So I'm doing my rotations. I'm paying school to work for free essentially. So I had like no money coming in. So, and it was like, around the road from my house. So I was like, I'll take that job. That sounds good. Twice a week for 2 hours, whatever it is, make a couple bucks. And then once I'm there, they were saying, listen, now that you work for us, you work with us, you can train for free. You can try any class you want. And I was still kind of like, I'm good. And, Monster, where I train, they have Muay Thai, they have Judo, they have wrestling, they've got the Jiu-Jitsu. Jiu-Jitsu is kind of the main thing. It's 90% of what that place offers. But they've got the striking. The guy that owns it is a Golden Gloves boxer. He's a 3-4 stripe black belt in Jiu-Jitsu. Like, the guy's a machine. But they offer everything. So I was like, I'm good. So eventually one night, like the boot camp class that I was teaching ended, and the no-gi class started at 6:30. And I was like, it's no-gi's probably the easiest foray because I was a wrestler, and I'll kind of work my way into that. My buddy I was like, all right, I'll stay tonight. I was like, what do I have to wear? He goes, just a pair of shorts and like a rash guard. And I surf, so I had rash guards floating around. I was like, I'll bring one. And I go, and I haven't done any kind of grappling in forever. And, my wrestling helped my rugby quite a bit because, form tackling was huge, and my cardio was insane because of rugby. So I get into this first jiu-jitsu class, and like I'm throwing dudes around. Like I've never done anything before, and I'm beating the snot out of like white belts, blue belts, some purple belts. I'm beating up a couple brown belts. I gave like a real hard time to, and they were like, "There's no way this is your first night. You're sandbagging us. This is bullshit." And like all of a sudden, my ego alarm goes. I'm like, "All right, I think I kind of like this."
Yeah.
So then I kind of got hooked. So I went to another class, and I got like hooked, and I was like no gi all the time. And I was having a lot of fun and great workout, and the camaraderie at the school that I train at is amazing. It's like a family. Everybody loves each other. Everybody helps each other out. Everybody's great. There are no dickheads in this school. Every school's got like the one guy who you ever wish wouldn't show up. There's not one guy like that in this place. There's not one person that nobody likes. So it's a really cool community there. And so then then I got hooked. So then I was like, well, why am I still like a white belt? Like I don't understand. Then the instructor Derek was like, you never put the gi on. He's like, I don't care if you throw me around. He's like, you're never getting promoted anywhere because you never put the gi on. You have to you put the gi on to get promoted here. I was like, all right, fine. So I started going to the gi classes, and all of a sudden I'm like stripe, blue belt, stripe. So I got promoted pretty quickly because I was training for a while, probably like 2 years before I even put on a gi.
So wait, this is interesting. You're the first person I've ever talked to who had the opposite experience. Like everyone, and myself included, is like they went in, they kind of thought they would steamroll everyone, or they were athletic and just kind of figured they'd fall back on their laurels, and got like first time I went, I just got the floor mopped with me, and I was not like an unathletic sedentary person. I had a lifetime of athletics. I didn't have a wrestling background, but it was the experience of getting destroyed that made me go, I got to learn more about this. This is insane.
Yeah.
It sounds like yours was the opposite. You just went in there and truck sticked everyone, and we're like,
don't get me wrong. I would grab a brown belt or a blue belt or a black belt or a high level purple, and I mean, I was every 30 seconds tapping again. Like I was, don't
Okay.
get me wrong, I
Okay.
was
Good. So
tapping
you're
my face
human.
off, and I was, oh yeah, yeah, yeah. I was tapping my face off, but like
Yeah.
my engine just would never. People were like, "This is our sixth 5 minute round. It's like you just start like I had a crazy engine." And again,
I think that's
the
wrestling, man. When you
yeah,
train, like if you
yeah,
had to choose, I was talking to someone else about this, Heather Linden at the UPI. Like,
oh yeah, Heather, yeah,
if you are choosing a prerequisite to take into your MMA career, and you can choose anything that's out there, Muay Thai,
wrestling.
Jiu Jitsu, you choose wrestling because of the
Mm-hmm.
engine that it puts in your body and the mentality. Because back to the very beginning of the conversation, what we were talking about with like is it the toughness, the weakness, being a wuss, not like there is no space in wrestling. If you
No,
wrestle past like Pee Wee, you're through the grinder. You're just through it.
yeah,
The
you're a
conditioning is
certain kind of
so
mentality there. Yeah,
yeah, and it's
yeah. I always say
so
like it's.
aggressive.
I think it's easy to teach a wrestler to throw a punch. It's hard to teach a puncher to wrestle. So like you
Yeah,
said, like if I had to pick like the ultimate base to start with an MMA
yeah,
career, it's wrestling, 100%.
100%.
And he may never be the greatest striker ever, but it's part of his tools. But if he gets you to the ground and then can just smother you, like you're done. Like
And
there's no beating them with the.
you can eat a punch to get a takedown all day, especially when you're
Mhm.
a bonehead pro MMA fighter who's just got a noggin. You
Yeah,
cannot eat wrestling to throw a punch. Doesn't
nope,
work that way.
doesn't happen. It does not happen. So I agree with you. I think wrestling is the number one thing you'd want to pick to be like your base to start like an MMA career. And you look at the guys that are out there now, like, I mean, Bo Nickel, the dude is just destroying everyone. And his
So
pedigree in
nuts.
wrestling is unbelievable. Gregor Gillespie, who has not fought in like over a year and a half, like the guy just smothers people. His engine is I think his last fight versus Alameda, like Alameda came out of that second round and was breathing so hard and he was already done. Just like he broke him, like
Yeah.
Gregor broke him in one round. And it's interesting too when you go back and watch one of those fights when Ian Gregor talks about it. He said like, I was tired after round one, so I knew if I was tired, he was dying
Yeah.
because I
I
don't
watched
get
that
tired.
interview. Yep.
Yeah.
Yep.
So it's like that's just that wrestling mentality. Like
Yeah.
they will go until you're puking shit at the same time, and then you
Yep.
keep going some more. Like they just have that grit to them that it's hard to attain with any other sport. Yeah. So for me, it was definitely the wrestling. And my top pressure was crazy. I could make you tap just by putting my shoulder into your chest and applying pressure.
Right.
But eventually that goes away, right? And
Yep.
then the technique plays a huge role, and you find yourself you're getting caught in the same shit over and over again because a double leg in wrestling is a huge no-no in jiu-jitsu because your neck's wide open for a guillotine, right? So you
Yep.
got to change your double leg if you're doing a kind of stand-up. You got to change things a little bit. This is where now why I probably have been stuck at the purple belt level, A, because of the amount of which I train these days, and then B, like wrestling is so ingrained in me that I can't break those habits. Like if I was on the verge of passing out and I go into autopilot, wrestling kicks in, and I'm just going to get in trouble every time. So I'm going to get caught with this, I'm going to get caught with that. So and that was one of the things the owner there, Derek, to me all the time. I would just hear from across the room, Amato, use your jujitsu. All right, whatever. I get it. Like, so now when I train, it's only gi, and there's a number of reasons for that. I've had 2 discs replaced in my neck about 5 years ago. So in no gi, like what's the first thing they grab? It's your head to get control.
And what do you use for controlling them? It's so
Your
much
head.
forward
Yeah.
pressure and driving and like.
So I had to change my style up a little bit because my surgeon who did my surgery, who was awesome, by the way, and I got him because of Chris Weidman. So I'm kind of backtracking the story a little bit. So I had herniated every disc in my body is herniated. I played front row rugby, and I was just like I was the hooker, and all the pressure from all 2 teams go through my spine, and I'm the center point for everything.
Yeah.
So I spent the better part of my late teens and 20s to shore up my body to make sure that it didn't break in that pressure, which also now means that I'm immobile, right? So like I turn like Batman no matter what I do, like everything's just stiff, but like I'm not going to break my neck, so that's great. So I remember the hit particularly. I remember I took the hit and I get up and both my arms were numb, and it wasn't like a stinger numb. Like it was a big difference. Like I knew, I was like, ooh, something's really off.
Wait, this happened during your rugby career, you're saying?
Yeah, this happened during my rugby career. I remember the hit. Like I said, I got up and I was like, everything was numb, and I'm like, something feels off. It didn't feel like a normal stinger. It was on both sides, but I shook it off and it kind of went away. And I kept playing like a meathead,
like an idiot. Yep.
Yeah, and one more hit that game later on in the game, something else happened where I'm like, something like I couldn't. Someone passed the ball, like I couldn't close my hands on the ball, like they wouldn't work. Like I was like, this is really weird, but I let it go. Like when that Monday comes, like next train wreck Sunday hits, so I feel like I got hit by a car all this Sunday. I'm lounging around watching TV, trying to recover, and I get back into training. Now a couple of years go by and I'd have random issues here or there, but nothing that was like super striking to me where I'm like, oh, I gotta get this kind of checked out.
Yeah.
So now I'm in PT school and we're going over different clinical testing about, in particular, like cervical spine injuries. We're going over cervical myelopathy.
That's
And
what I
all
have,
the
C5, C6.
yeah, I was C5, C6, I'm sorry, C4, 5, and 5, 6 are what I had replaced. So we're in the orthopedics class in PT school, and they're doing the neurological testing, and I'm positive for all of them. And my classmates are like, holy shit, like we never even some of the teachers haven't seen a positive test for Babinski or Hoffman's reverse supinator. I've got all these things, and they're like, oh my God. So they call over the professor, and he's like, there's no way. He doesn't want me. He just looked at me and goes, yeah, that's not good. And he walked away.
Yeah.
And I was like, oh, huh, okay. And I let it go. This was now 7 years after that injury I had initially. Right. So it's been going on for a while. And, my neck's always stiff. I always turn like Batman. So, like, people are always like, weren't you in pain? I'm like, well, yeah, I was always in pain, but it's the same level of pain I've had for the last 10 years. So it didn't seem out of the ordinary to me. So now fast forward to probably about 6 years ago. My wife's pregnant with my second kid, my son. And I am walking. We're having my father's 70th birthday party at my sister's house. My mom hands me her like beloved crystal vase to bring out as part of this like centerpiece thing. And I'm walking to bring it out, and I had drop foot. So my foot just drops, and I trip, and I drop the vase. So now I felt awful about breaking my mom's like heirloom thing.
Yeah.
Then I'm like, I'm about to have a kid in like 6-7 months. Now I already have my daughter; she's almost 2 years old at this point in time. But I'm like, I have to carry on an infant. Like, what if this happens carrying my son? Like, I don't want to drop my kid. Like, I got to do something about this. So I finally go to see a couple specialists, and the first doc I see was an orthopedic surgeon, and I mean the guy looked like Doogie Howser. I felt like he was like 23 years old. I'm like, there's no way you're experienced enough to cut my head open. Like, I'm not going with you. And his answer to me was, your only option is a fusion. I'm herniated from C2, 3, 3, 4, 4, 5, 5, 6, 6, 7. All of them are herniated. They're all pretty bad. But what happens is, and why you get cervical myelopathy, is that they were centrally herniated, so they're pushing on the spinal cord. So everything from the level
nerve pain and function,
everywhere. So it's everything from the level of C4 down is affected. So your legs are involved. Everything's involved. And one of the reasons why I had gone to go see the besides dropping the vase was like, I'm working on patients. I noticed when I was doing like manipulation to a patient, like a thoracic manipulation, my hand would cramp up and I had to like pull my whole arm apart. And I was like, well, that's annoying, but not, it's not ending my day. So I let it go. And I'm giving my daughter a bath. And I'm leaning over the tub, and like my whole left side is like on fire, like burning. And I'm like, well, that's weird too. But again, it goes away. So I'm fine. I'm good with it. The final straw is dropping that vase. So then this guy tells me my only option is a fusion. And being in the field, I'm like, a fusion is not really what I want to do. Like there's not a lot of good outcomes with a fusion. And not only is it going to take me out of anything I want to do for the next 6 to 9 months, there's a good chance I'll have to have another fusion in a year and another one. And like, eventually I'm just going to be one steel rod. And I'm like, I don't want to do that. So I had reached out to Chris Weidman. And I said, hey, listen, like you had a surgery where they did a replacement, right? And he's like, yeah. I'm like, I was successful. He goes, yeah, I'm fighting still, right? So like, I want your docs. He had a replacement. Yeah. Yep. So a disc replacement at 5'6" was the level he had, I believe. So then I'm like, I want your doctor's name. So he gave me his doctor's name. I'm going to meet the guy. And the guy was like, listen, he's like, if I was to be the average Joe and test you, he's like, everything's strong. There's nothing, I would say there's nothing wrong with you. He's like, but because the level you're at, like, yeah, you break a little bit here and there's a little bit of this there. And he pulls on my MRI and he just goes, whoa, that's a crappy MRI. I'm like, yes, I know, doc, thank you. Yeah. And he's like, all right, well, here's what I see happening. He goes, these symptoms are going to start. Have they been getting progressively worse fairly quickly? I'm like, yeah, over the last 6 months, it's been like a steep downhill with everything. Yeah. So he's like, listen, he's like, you need to do the surgery. He goes, however, you're a prime candidate for replacement. He said, you're young. You have no arthritis. Oddly, I have no arthritis in my neck. He's like, you're a better. He goes, honestly, you're a better option for a hybrid. I would replace one level and fuse the other. He said, but insurances won't cover a hybrid surgery. So I'm just going to replace both of them because the outcomes will be pretty good for you. Yeah. So I replaced 4.5 and 5.6.
Did you get mobility back as a result?
Yeah. I mean, if I have full range of motion now, I get really stiff. And so I get trigger point injections every month and I do a lot of soft tissue work. But like I maintained all my range of motion, which is why I didn't want to do the fusion. So I went home the same day of the surgery. And this is why I went with the guy too, besides the fact that he got Weidman to fight again. And I'm sitting there and he's showing me pictures. Like, oh, this guy, I did surgery on him on Tuesday and he's here at St. Andrews in Scotland. What's the main in Scotland, the big like golf? St. Andrews, right?
Yeah.
Yeah. So he's like, here he is at St. Andrews playing golf 6 days after surgery. I'm like, oh shit. He's like, and he had the same levels as you. I'm like, all right, you're my guy. And he made me feel super comfortable. And so, I mean, I took a week off of work and that was it. I went back to work a week later. 2 days after surgery, I was in my backyard raking leaves, like all things that like with a fusion, you can't even think about doing that kind of stuff. You're limited to like
Yeah.
5 pounds per hand for like 4 months. Like you can't do anything because the bone graft has to fuse and they got to make sure everything's going on. With a replacement, there's nothing that's got to fuse. They literally scrape out the disc that's bad and they zap screw in this new fake one and you're done. Nothing has to adhere, nothing has to fuse, nothing. That's it.
Between the vertebrae, they're actually removing the disc itself and then placing in like a cushion, kind of.
Well, no cushion, yeah. So there's some of them are a solid piece of metal, just a big, thick, solid piece of metal to replace the disc. And the one I have is the Prestige LP. It is a ball and socket joint. So it actually maintains 6 degrees of freedom so that you can get all the rotation you need and all the different bends and twists you have to do.
And you eliminate all nerve pressure because you're isolating it to the disc where the balls. Yeah, right. Wow.
Yeah, and then the disc's gone. So there's no more nerve pressure on the discs. A lot of my symptoms reversed, which was good. Some of them still kind of hang about, but they're not going to get any worse, which is fine by me.
But that made you switch to gi.
Yes. What I'm saying is, this is my roundabout answer to get to what we were talking about. He told me, he's like, listen, I was like, can I get back to jiu-jitsu? Can I get back to snowboarding? He goes, listen, man, he goes, you can do everything under the sun you want to do, except for direct pressure down on your head, like a lot of it. He's like, so like, 90-mile-an-hour car crash wouldn't be your best friend right now. He goes, and honestly, depending on how you tackle in rugby, direct force on your head is not the best because those ball and socket joints can't handle that kind of pressure and they likely fail and you have to have them taken out and you have to be fused. So which is why I moved to gi, because now people are grabbing lapels, they're grabbing sleeves, and they're not ripping on your head first place. But as a wrestler, I used to use my head as a third appendage all the time to like tripod and hold myself in place. So I had to change that part of my game up. But other than that, like it's been pretty good.
This is we're talking within the last 5 months, I have gone back to get an MRI. So C5, C6 herniation, and then T3, T4 protrusion out of the right side. It's all right side of my body. Everything's right side. Cervical, I can't even say it. Myelopothy. Myelopothy. Yeah. I had like referred pain down my right side, a whole laundry list of everything you just said. But it got me thinking, I'm like, I'm not going to stop doing jiu-jitsu. I love it too much. It's too important for me in my head, right? But what's the right thing to do? Because I do the same thing. As soon as I learned how much I could use my head to keep people down, whether it's like lapel and pant and I'm driving my head, tripod passing, when you're holding, anything like that. If you have a strong neck, I mean, it's a great tool. It's talking 10 pounds of additional weight that you can move around on somebody. But I can feel now, right? It's some days it's good, some days it's bad. Like today, I did first set with a trap bar, put the weight down, and I called the workout because this T3, T4 thing flares up. It shuts down my lat and my scapula.
So it's compression.
Totally.
That's the problem. It's compression.
So what is the right thing to do for the practitioner who wants to do this for the next 10 years? Like, should you not do gi? Should you adjust, or no gi? Should you adjust your game plan? What's the thing to keep us out of your office?
Yeah, I mean, I'd say first thing is adjust your strategy a bit. Like, so if you were big into using your head as another body part, like you can still do it, right? So it boils down to, with the discs right now with you, it's the compression is squirting the jelly out of that disc and pushing on nerve roots and causing pain.
Yep.
So what you can do then to assist that and to mitigate the symptoms is decompress that area. So you go to jiu-jitsu class, hop on a traction device, decompress the neck, give that disc some space to kind of reduce a little bit. Little known fact, discs can reduce themselves back into place, quote unquote. They won't go back full. They won't be 100% because once that vacuum seal is kind of broken, that's it, you're done.
Right.
But you can have a major herniation sticking 50% of the way outside of the vertebrae from where it is, and you can reduce it to 10%.
Wow.
So now you have more like a bulge. Now there's no more disc pushing on nerve root. All those nerve symptoms kind of go away and you're good. Now you're at a greater risk of that happening over and over again over time. But if you can mitigate it with decompression techniques and other things like some of the McKenzie protocol work you can do, you can then reduce the disc again and go back to what you were doing. And you can do this forever, unless it becomes a part where the disc becomes desiccated, where it's like split and there's a whole big problem there. And there's nothing you can do at that point will help it. But a lot of it is, and this is why I love the iron neck. And there's another neck thing out there called the next level. These are things that you can.
I like that.
Yeah. I wish that was around back when I started wrestling and football, because I was the guy, 2 45-pound plates on my head. And I was a 20-inch neck. I was shoulders and ears. I had no neck at all.
Yeah.
I never broke my neck.
Glory days.
So it was great.
Glory days.
But to get to that level, the risk reward ratio, I wore away my discs faster and I put them at a greater risk of degradation. degenerative disc disease, which is a catch-all term that I can't stand. But so the disc
You know
space
what's
got
funny?
lower, and
The Santa Monica Orthopedic Group did an MRI on my lumbar because when I started jiu-jitsu, I was competing in Olympic weightlifting. I was training all day, and then I was going to jiu-jitsu at night, and my left hip would just flare, flare, flare. And I went and I got an MRI. Santa Monica Orthopedic Group guy goes, mind you, got an MRI, spent a ton of money to get an MRI, right? Go into his office, 5 minutes. He goes, well, and he pulls up a screen with a bunch of shit I can't see in a font I can't read. And he goes, you have degenerative disc disease in your L5 vertebrae. Makes total sense because of your history as a skier and doing the jiu-jitsu stuff. So do you want to stop doing that? And I was like, well, definitely not. He's like, okay, so I would just monitor it yourself. All right, good stuff, champ. See you later. Left. And I'm like,
yeah.
You all that, and you throw some big blanket term on me that like you use for pretty much every single person that comes in your office.
Degenerative disc disease is inevitable with the aging process. We are, whether or not you're a believer in evolution or the Adam and Eve style,
beings that walk around under gravity.
We're upright beings who were designed to walk on all fours, essentially, right? So the discs are meant to be some sort of compression at some point in time, but not for the amount of pressure that gravity is putting on it. Right. Even if you look at like a dermatomal list, it makes a perfect sense in the vertical with where the discs are and where they cause sensation and everything else in the body when you're on all fours. So degenerative disc disease is a natural aging process. Everyone's discs are going to lose height and get smaller in space throughout time. Now, if you're a competitive or you're even a remote athlete, you're going to speed that process up because you're adding more weight, you're adding more wear and tear. I wish they would just do away with that term, because if you took 100 people from the age of 30 to 45 or 50, all of them are going to have degenerative disc disease. What does that mean? Nothing. It means absolutely nothing. Is that disc sticking out far enough or it's protruding enough to push on a nerve root? Well, that's a different story. Now you got like a herniation, not really a bulge anymore. But people who don't know, they hear the word disease, automatically they're like, I'm dead. That's it. The word disease is also, it's going to kill you. Degenerative. There's these big fancy terms. To me, you're just telling the person they have a natural aging process. Now, on an X-ray, you can see this. The size is different. Like, that L5 all of a sudden is like barely fit a piece of paper through there. Right. That's when an MRI is called for, because why is it lost its height? Is it protruding because it's been herniated, which you're not going to see on an X-ray. X-ray only shows dense stuff, so bone and cartilage. You will see nothing else on an X-ray. You'll see dead space, which may suggest that there's something going on there, but you're not going to know until you do the MRI. So the MRI will tell you, all right, well, now you lost that disc space because you have a massive herniation to the left side of the vertebrae. And that's why the disc height is so much smaller. All right, well, now it's not degenerative disc disease. It's a herniation at L5.
And then what do we do for now? It's specific to the person.
Now it's specific to the person, to that specific level. It's not just, oh, you have degenerative disc disease across your spine. Oh, yeah, okay, duh, so is everybody else. But now that level, and now that correlates with, now you have sensation issues on this side of your leg. Okay, that's the L5 dermatome. You have weakness in this sort of muscle. That's the L5 myotome. Okay, all this makes sense in conjunction with an MRI to give you your actual specific diagnosis instead of just a blanket term. And part of that is verbiage that's been used for years, and they just do it because we've always done it. Part of it is laziness. Part of it is they don't have the time to dive a little deeper into what's going on, so they just give you that kind of blanket term. There's a lot of reasons why you hear that kind of thing, but it's a garbage term to me. I wish they would stop using it.
If we can talk specific to jiu-jitsu for a moment, I've forever, basically since starting jiu-jitsu, it's been like a little over 5 years, I've had a major qualm with the warm-up process. And all respects to like the OG Brazilian and Japanese structure of how things are done, I totally get it. But I've posed the question to Heather, to Jason Kalipa, to Mike Pekarski, and I want to ask you.
Oh, Dr. Kickass, my man.
What is your... like, if you can talk a little bit about the warm-up process, maybe from your perspective, what the purpose of a warm-up is, and then take into account cervical injuries, lumbar injuries, thoracic injuries, hip injuries, all the things that you see in your knowledge of combat sports. What should we be doing in the first 20 minutes of class?
That's a fair question. I think the general premise of it and the idea is correct. Get the blood flow moving, warm the tissue up. So you do your jog, you do your inside, your outside shuffling. I mean, it's probably the same countrywide worldwide across jiu-jitsu schools. You do your jogs around the mat, face in, face out, shuffle, karaokes. Then you get in your lines and you're doing your hip escapes, you're doing your shrimping. Those things to me are good. You should be doing those because now you're you're dynamically warming up your low back and your hip flexors and to do the things you're going to do for the next 45 minutes of training anyway. The barrel rolls and the monkey rolls, the forward rolls, the backward rolls are necessary, probably not. The push-ups you might be doing or the walking push-ups, all these things, like they're not bad. But I think you run into the problem with you have a class with 45 people. You're not going to be able to tailor the warm-up to every individual. So you kind of go with what the basic premise is and how can you get the most bang for your buck in an 8-minute warm-up. So I think a lot of it is good as far as bringing the blood flow to your everything, warming the tissue up, getting blood flow going. I think it could be a bit more specific to jiu-jitsu. So 20% some pummeling, 20%, guard passing, things that are going to – I'm big into dynamic warm-ups and mimicking what you're going to be doing for the next 45 minutes to 3 hours, whatever your sport is, in your warm-up. So tailoring it more to jiu-jitsu at like half speed or 20%, I think would be far better than just doing lines of push-ups and sit-ups and pull-ups and, wheelbarrows and all the other stuff that you see across the jiu-jitsu school. I think it's well-intentioned. And again, the basic premise of it is you're going to get everybody good and warm to reduce the risk potentially of injury on the most global blanket version possible, right? Because this guy's got a shoulder, that guy's got a hip, that guy's got a neck. You can't tailor it to every individual specifically for a full class. But that's where it's on the onus for the practitioner to say, hey, that movement doesn't work for me. I'm going to skip it. I'm going to do something else instead to the side here or something like that. But again, I would like to see them do more jiu-jitsu specific movements at a much, much slower or much, much lighter version. So, you're going to do three guard passes to the left, 3 to the right, switch. You're going to do, whatever it is. Just and more stuff like that, I think would be a better served warm-up than, the arbitrary push-ups, sit-ups, that kind of stuff.
Do you see a space in there for any kind of like cervical preparation? So when I think of the warm-ups, the two glaring things for me are there's no preparation specific to the neck, and so many people injure their neck in jiu-jitsu, and it either freaks them out or it stops them completely from ever coming back. And so from a business standpoint, it's actually foolish of the school to not address this, right?
Agreed.
Also, look to any black belt in the history of the sport. They all have fusions. They all, this is not something that is
the fingers are taped up and mangled.
Right. It's not something that's not going to happen to you. It is going to happen to you if you don't address this. So that is one issue for me, and maybe we can talk about what that could look like. And then the second thing is that you warm up and then you sit. And many, not all schools, and it depends if it's a competition class or not, but in a lot of cases, it's a warm up and then a sit, and you watch techniques. And most of the time people do some techniques and then they kind of have a chat. Whereas if you look to like an NFL, NBA, any other kind of sport, that's exactly what you said. It's like a little bit of prep, dynamic warm up into the drill. Right now we're running routes. Now we're doing drill specific to the sport. Now we're doing shots and we're running, routes on the court or whatever it is. Whereas they're ramping up, sitting, practicing at a really low heart rate, cooling all the way back down, and then I'm going, all right, live training. That to me it's like a petri dish for injury. That structure.
I agree with you.
Begs
I agree with you 100%. I always say, I think, and this goes to, I was helping coach my kids' wrestling program this year too, which I didn't want to do. I got dragged into it, but it made my son and myself closer, so it was good. But the same sort of issue with the kid wrestling stuff. You do all this warm stuff, and then they're supposed to sit there and watch you, and then learn the move, and then maybe drill it. And then, so I think what would be better served, even in the jiu-jitsu schools, is like maybe we go over the move of the day first. Circle everybody up. We're going to go over arm bars today. Here's how you do this. Let's roll through it nice and easy with each other. Okay, cool. Now we do a warm up, and now 50% positional training. Go over the arm bars we just did before. Cool.
Done. Now
we go into live. Boom. Done. I think that's a much better way to do it. Is to all right, move of the day, move of the week, move of the month is an arm bar from here or this and that, and they show it. Everybody kind of drills it really easy. You walk through it 5 times each side, and then you go through your warm up, and then you go through your positional training, and then you get into your live stuff. I think that would be a much better way to do it.
I mean, if I'm a school owner, here's what I don't want. I don't want people coming in for the first time, getting tweaked, and then going and saying, oh, yeah, I tried it at that blank academy, and I got messed up. I want people coming back and going, oh, my God, I feel, like having all the positives from jiu-jitsu or maybe in wrestling, whatever the thing is, but being so psyched about it and then being blown away by how much the professor and whoever is caring about their well-being from it, we want people to fight and have fun and really go at it, but caring about their body and their longevity,
Yeah.
which maybe it's just out of the discussion because they don't think of it from like a training and an athletic performance standpoint. But what would you say about the neck prep stuff? What is
So yeah, that was the
amount
question you had
for
before.
that?
So I now with the iron neck and everything, this was back to what I was saying before, is I wish that stuff was around when I was coming up with wrestling and football, because a lot of the research has shown how important isometrics are for muscle activation and even hypertrophy without degrading the disc any faster than it would with normal wear and tear. So like to me, isometrics are huge. If you can just do like group isometric work, you can start working on just four-way isometrics, changing directions, nothing moves, but you're constantly activating. Controlled circular motion with no weight, nothing added to it, to warm everything up. As a group, I think that would be one of the best things you could do. Professional sits up at the front, he goes, all right, hand on the left side of your head. All right, push, hold for 10, cool. Hand switch over to the right. Go over is like an isometric positioning stuff. What I wouldn't want to see is the old school bridging, Granbys, things where you're putting yourself in a tripod and doing that again. I don't think that's necessary. Now, is that going to happen throughout the course of a class or training? Probably, but you're not forcefully doing it for 5 to 10 minutes straight trying to warm your neck up. I would like to see that stuff kind of go away.
That's really good for me to hear.
You're putting a lot of pressure on there. Yeah.
I was actually going in early and doing modifications in the hopes of building up to that, actually. So like from the knees, but doing the head rolls. So you're saying that actual, the downward compression on your head, even though it's a warm up, it's actually, it's doing the same thing that an isometric would do in terms of bringing like a blood and heat to the area, but you're actually doing compressions. And so it's that compression. If you took an individual had to do nothing else except those tripods every day, you would actually begin to see degeneration or herniation as a result of solely that.
100%.
Wow.
Yeah. You're forcefully putting, the human head weighs anywhere from 8 to 12 pounds. Some people maybe 15 if you're a big Cro-Mag type person like myself. I was the guy that had to wear the triple extra large football helmet in the back covered in dust because nobody uses it since 1974. But that your discs are made to withstand that much weight, 8, 10, 12 pounds, maybe a little bit more. Now you're putting yourself in a tripod, you're putting your 180-pound frame all on, a third of it, right, on your neck. Now that's 80, 60, 90 pounds going through that disc, which is made to only hold 10. And now you're moving with it. Now, not only are you putting pressure through it, now you're moving different positions. So you're asking to speed up the degeneration process. You're asking for other injuries. So
and
the idea of it is fantastic.
There's not a benefit in that, like I know I'm about to go into the role, and in the role, there's a likelihood that I end up in this position under not only my weight, but also now the weight of my opponent. And so you're, the same way that resistance training works against a muscle, and I'm asking if this is just a fallacy, that by doing these incrementally over time, you're actually putting strength and structure around those vertebrae and discs. That is not happening.
Well, let me ask you this.
Yeah.
In a boxing event, there's a good chance that a well-placed uppercut will put you out.
Right.
So to prepare for that, are you going to stand there and let your partner throw his hardest uppercut he can to your chin before you go into the fight?
Definitely not. But would there, I guess, to that example, is there some benefit to having your coach like stand with his glove under your chin and kind of go like, over time? Does that build resistance?
So this kind of thing will build up strength, yes. Right. So putting something under here and smaller movements in like an isometric fashion, yes. Yeah. So the end result is you want to build strength around the vertebrae and the discs without compressing them, and that's where the isometrics come into play.
Gotcha. So that's the fours.
That's the pushing on each side, the 4 ways. That's the rotation. Yeah. That's I like the iron neck where you have the resistance and some rotation to it. Again, there's no compression there. You're not putting anything down on the neck itself, but you're getting blood flow. Those muscles are getting tight in response to an outside source of resistance. So you're going to get way more bang for your buck doing that. To prep you for that tripod position, you'll get in a fight or a jiu-jitsu match or training. But to spend 10 minutes kind of rolling side to side, and as much as I did that as a kid and growing up in wrestling, I wish I didn't. Now, knowing what I know about anatomy and the human body and biomechanics in general and how detrimental it really could be for that, there's really no place for that for me anymore. Like you don't need to be doing it. Should you get there 10 minutes early and go through your isometrics? Yeah, totally. Dude, go for it. Yeah.
No, this is really good to hear, because again, back to our a discussion about kind of, someone looking to start training, right, for jiu-jitsu, they Google search. If you look up, my neck hurts from jiu-jitsu, what are some exercises? You're going to find Granbys, you're going to find tripods, you're going to find weighted neck flexion, weighted neck extension, all these
Yep.
things. And you're going to find a lot of loading directly on top of creating compression, which is, it's very reassuring and great to hear you say that you can achieve the result that you're looking for, which is the strength and building the resistance, but you can do it without compression. That's a big misconception, myself included, right? Especially someone who didn't have a background in this activity, right? For people coming in this later in life who don't know and they just want to try to do the right thing. Because you go, okay, what position I end up in? That one. How can I strengthen it? I'll do this. And that's not what you should be doing at all. So that is the golden goose of the conversation.
Yeah, and that's what we've done for so long in grappling. I mean, Christ, you look at some of the old wrestlers, the Russian wrestlers in the 70s. And, I mean, they're doing flips off their neck and spinning around on their head. And like, was their neck strong? Yeah, but I guarantee those dudes aren't walking today. I guarantee those guys have had multiple surgeries or they're miserable. Tremendous atrophy in their arms because the disc compression has put all that pressure on those nerves. Like, just because we always did it doesn't mean we should still do it. And this is where like the Iron Neck guys kind of really got it right with like taking the principle of isometrics, making them not boring. Because I mean, how fun is this to sit there and put pressure on your head in different directions?
Totally.
Giving it function, giving it meaning. You're getting everything you want out of it as far as the strength and the support for the area without any of that compression, without any of the wear and tear on the discs. Because what it boils down to is, you're doing all this training to make muscle hypertrophy or muscle strength as the result because there's contractile tissue there. Yep. A disc is not contractile tissue. You're never going to make that disc stronger. It doesn't happen.
Wow.
So you can't make the disc any stronger. It is just there for cushion. That is it. So no matter what you put into it or onto it, you're not going to change its ability to withstand any force because it is what it is and that's it. So what do? Is you build up everything around it to support that structure. So you can't strengthen non-contractile tissue aside from bone, because bone is a response to force put on it, but you just lay down more bone in that regards. But that doesn't happen with discs. It doesn't happen with meniscus. It doesn't happen with any sort of cartilage, really. So you can't make those things stronger. So all you're doing is speeding up the degeneration process, really.
That is so important for me to hear. That the way that you put it, the description of the discs not being a changeable thing is really important to understand, because I think that is the general misconception, is that you can make those stronger. You can make them more resistant to gravity, more resistant to impact, but it's the muscles in the neck that surround that and support that. And the safest way to train that is through isometrics. If you think of
isometrics, or even, I mean, you could do light resistance with actual motion, but again, putting a 55-pound plate on your head and doing like neck flexion is probably not the best idea. You can get a lot of the same results without that much force and that much stuff put through the neck.
If we can touch finally on just in general, if you're looking to hedge your bets against injury in jiu-jitsu, there's obviously this unpredictable element of the sport. Combine that with the fact that many times people are bigger than you, faster than you, they outweigh you. It sounds like in your position, you're probably one of like the bigger, stronger people in the academy. But to the person who's, average size, smaller size, what's kind of the low-hanging fruit to really give yourself the best shot at staying healthy from a strength and conditioning standpoint or a mobility, flexibility standpoint?
Good question. And I'm going to kind of backtrack a little bit. So we were talking before, like I have found in the last 8 years or so of being involved in the jiu-jitsu world is that so many of them don't weight train at all. They do no resistance training. It's just more jits, more rolling, more training. They're afraid to train weight training because they think it's going to make them slower or bulkier or tighter, which is just, patently untrue.
Right.
So I think some form of full body circuit training, resistance training, is probably the best bang for your buck for the jiu-jitsu player. Twice a week, total body, moderate high intensity, kind of constant movement, so your heart rate's always up, that kind of thing, but the weight doesn't be super high, full range of motion, focus on your form kind of thing. If you can get 1 to 2 times a week of that in on top of all your JIS training, is probably the most beneficial. Any kind of bodybuilding training program is an absolute waste of your time, and it will be detrimental to your game.
Facts.
You'll be so sore
Facts.
from your chest workout on Monday that you can't train jits all week because
Yeah.
you can't get your arm behind your back to do anything. So something that's going to give you some increased strength, mobility, stability without making you so sore that you can't move again is paramount. So that's why I like full body circuit training while you're training. Now, let's say you're the combat sports athlete and you've got 15 weeks till your next competition. If you want to do like a base level strength for 4 weeks to build up a good platform, then absolutely, that's great. I think it's
Have at
fantastic.
it.
But in the end, you're going to get to more of like a sport mimicking activity where you're constantly under movement for 3-4 minutes. You're circuit training, you're hitting every body part, every different angle, transverse plane, frontal plane, sagittal plane, rotational work, all within one sort of circuit and just kind of back to back. So to me, that's like the golden goose for some resistance training for combat sports athletes. Now, is there no room for traditional strength like the old school 5x5 or 5-3-1? No, like I said, you can definitely do that stuff if you have time where you can back off some of your grappling. Now, this is talking about like the pro athlete, like the pro fighter. The average Joe, like yourself and I, who work 5 days a week and love to train jits, like, are you going to be able to do like a bodybuilding program? Probably not. Is it worth your time? No, not at all.
And I mean, on this note, it's good that you said that. Like, I feel like I've been working backwards through injury over the past 5 years of going from competing in Olympic weightlifting to trying to find the balance of Olympic weightlifting and jiu-jitsu, which there is no balance for those listening.
Right.
Move on to strength training jiu-jitsu, but high frequency strength training. And then really realizing for the last year, it's been 2 days. So it ended up getting to exactly what you said. It's 2 days. Some strength work in the beginning that compound lifts just to maintain what spent a lifetime building. But then it's more like kind of circuit based clusters that are functional to jiu-jitsu, get you moving through multiple different planes. And I found this out because I kept fucking myself up because the high intensity periodized Jim Wendler 5-3-1 truly intense stuff where you're really actually trying to get strong. It is such a tall mountain to climb when you're doing that and you're training jiu-jitsu 5 days a week. It's
that's hard enough on its own.
Yeah. When you're just sleeping and drinking protein shake, right? When you're just like in meathead mode, the trains they're going to crash into each other. It's going to happen.
100%.
And mine's crashed a lot of times where I'm like, because I love strength training. I love it. But the reality is that there's a reason that fighters do camps. They don't just fight. They do camps so that they can
build up to a peak level, come back down. Exactly. Yeah.
And so
it's the same for the average Joe. I think.
But if people take nothing more out of this, is that structure, that 2 times a week really is a sweet spot that allows you time in between. You can be pragmatic still if you want to pursue a goal, but you're not throttling your body. It just can't, it can't do it as much as
it comes down to what is your goal? Do you want to be a better jiu-jitsu player? You want to get to that black belt? You want to be a competitor and win gold in every tournament you want to go to? Then something's got to give, right? So you can't do the heavy duty strength stuff, but you got to do something to maintain, your strength and injury prevention as best you can. But if you're the person who trains jiu-jitsu once or twice a week and you do it because I kind of like it, but you love lifting, then go ahead, go do that. And just know that your jiu-jitsu is going to be suffered from that. And if you don't care about that, then it doesn't really matter, does it? But it depends on, again, what your goals are, right? If you really want to get better at jits, you want to be a great competitor, doing the bodybuilding style stuff is going to be nothing but a detriment to you. And not even bodybuilding, powerlifting or straight up strength training is going to be a detriment to the game unless you have that periodization sort of time thing like the pro athlete. But in the end, it's all about staying healthy and being able to continue to train.
Yep.
So the best bet for that is like a challenging weight where you feel like you're a bit of a struggle after 6, 10, 12 reps, whatever it is, but not to the point where you can't move for 3 days. There's just no need for do that anymore.
Yeah.
Especially if you're 30 plus, because the recovery isn't the same as it used to be.
If I could rapid fire you for a second here, and I know each one of these is a can of worms, but if I run through a couple, if we think kind of trends within the industry, it'd be that personal training, physical therapy, just the spread of social media really has jammed down the throats of anyone who's ever searched for anything fitness related. I know that you're going to be getting hit with every single one of the things that I'm about to say, but I'd love to get your perspective on like basically the net functionality. Are these things generally functional for the athlete? and specific to combat sports, so jiu-jitsu, wrestling, martial arts, or are they just BS and we should ditch them?
All right, so we'll go with, my answer will be trash or necessity. Is that what we want to say with this? We'll rapid fire this.
Yeah.
Under the guise that this pertains to making you a better jiu-jitsu player, right?
Yes,
That's what we're
and
looking for.
caveat would be, in any situation with actual true professionals, the answer to each one of these is going to be somewhat subjective because it's an individual needs basis. So this is more just like, but when your friend's sending you, the thing that you need to buy, you can reference this podcast right here and you can respond. So
and again, this is the caveat, is this is to make you a better jits player, to keep your jits game going. Is the movement and or product actually garbage? Maybe not. But for jiu-jitsu, yes.
So ice and compression.
Together or separate? That's different.
Sorry, compressed cold.
Compressed cold. Oh man, I say good.
Okay,
yeah. I'm gonna get a lot of flack for that, but I say good.
Cold immersion, and so we'll put this at 36 degrees or below for 3 minutes. Cold immersion.
36 or below, no need.
Okay. Heat exposure, so prolonged heat exposure, either infrared sauna or dry sauna, 25 to 30 minutes.
Good. So I want to build off that cold one real quick though.
Yep.
So I'm like Andrew Huberman makes a good point, as along with Suzanne Soderberg out of Norway or Scandinavia. It doesn't, for cold immersion therapy to get the benefit of the cold shock protein, it doesn't have to be super cold. I think the range is 36 to 56 degrees. Yep. So as far as getting the benefits of the cold immersion, I say 36 or below is not worth it. It's trash because no one wants to sit in that. It's torture. But if you can sit in 50-degree water for 3 minutes a couple times a week, I think that's good.
And we are saying,
now you're not getting.
We are talking specific to the body. Obviously, there's mental toughness training benefits.
Yes.
But we're honing in on
jiu-jitsu to make you a better player.
Yeah.
I think 50 degrees or so, 48, 50 degrees cold immersion, yes. 36 or below, that's no need.
And just to clarify, because there's a lot of speculation on this, timing to the training. So do you like to see that with your athletes before they train, after they train? Doesn't matter?
In general, it should be first thing in the day, first thing in the morning.
Cool.
Yeah.
Anti-inflammatories or oral anti-inflammatories. Cool.
Garbage.
Massage guns.
Good.
Interesting. Stem cells.
Yeah.
Stem cell therapy.
Not enough research for me to say good.
Fair. Love that answer. PRP.
Case dependent could be good. So like tendons, muscle, soft tissue stuff, PRP has actually been shown to be very beneficial, very good. Joint stuff, inconclusive evidence. It's probably a waste of your money.
Wow. Well, okay. I wanted to end with that because it sets us up to do this again in the future because, like I said, each one of those is a can of worms. We could spend 20, 30 minutes on each thing. That's funny you referenced that episode of Huberman and Soderberg because I just talked about it yesterday. And that was that one specifically is so important because everyone's doing a cold, like you can't look anywhere and
it's
not
everywhere.
See someone cold plunging.
It's everywhere.
There's specific benefits to the individual and they fall in different ranges than what you typically hear of. So honing in on that, very useful stuff. I really appreciate you coming on, Dr.
Yeah,
Amato.
absolutely. It was fun, man. I like it. I didn't realize it was an hour and a half already. It was fast.
I know, and I could do this, for hours. We'll have to circle back because I think these kind of episodes have been really valuable for people because it bridges a gap that I think sometimes people don't know how to bridge, right? How do you get in front of or even find a professional that actually understands this stuff, actually does it, and isn't just a weekend certification kind of guy? So I'm sure that this will sprout many other things that we could dive into. And maybe even sometime we could do an episode where it could bring you on and then another professional too within your field and almost have a round robin. I think it could be really beneficial. So
that'd be great. I'd be up for that.
And all your stuff will be in the show notes. So if people want to find you, reach out to you with their inevitable injuries that they will sustain as they pursue the black belt.
Yeah.
Thank you
Happy
so much.
to answer if I can.
Absolutely. Thank you, brother.
Oh, thank you, man. This was great.
Yeah.